Hi, Dr. Bo here. I wanted to go over I started out talking about if the head tilts to the side, the body has to level it back out by moving the ilium level and bringing the head back to center. But the main issue what I started out talking about was if the medulla is going through the atlas hole, there's the hole, foramen magnum in the skull, then the hole in the atlas, and you can see that's going through there. And if the atlas moves to the side, the patient just asked me, why do I have my pain on the left side? Well, the atlas moves to the right. The pressure on the medulla is on the left side of the medulla, right? If the atlas is a ring and you move it to the right, it's going to hit the left side of the spinal cord. And that's why the headache is on the left side, because the atlas has moved to the right and it's smacking the left side of the medulla. Now, the medulla is a special area that needs to be taught and explained. It's not like the spinal cord. So here we'll have a picture of the spinal cord, and you see it's like a butterfly in the center. The gray matter is in the center, and the white matter is surrounding that butterfly-looking gray matter. Gray matter is nerves. White matter is like the insulation of the nerve system. So in your brain, you have the white matter in the center, and the gray matter is on the outside. Now you notice the brain, if you look at the brain, it's not smooth. It's convoluted. It has gyri, which give the brain more surface area. And I've told you before that if you spreaded it all out and flattened out all the gyri, it's about the size of a football field. So the football field of nerves, that gives you the surface area to have all your gray matter or your nerves that are you. The white matter is not you. It's an insulatory material that protects the nerves when it's down here. And in the brain, it provides a substance of the center that the nerves can lay themselves out on in a convoluted field that if you spread it out, it would be the size of a football field. So gray matter is on the outside of the brain, and it's on the inside of the spinal cord. And that's why you see the butterfly in the center. That's the gray matter. So how did it get there? How did the gray matter that was on the outside of the brain get to the inside of the spinal cord? Well, it did that right here at the medulla oblongata. That's where I call it involution. The white matter went to the outside, and the gray matter migrated to the inside, and it happens to look like a butterfly inside the center. If you chopped off the neck right there and looked down, you'd see this butterfly structure surrounded by the white matter, which used to be in the center of the brain and the gray matter on the outside. So that happens right here. That involution, when the gray matter migrates to the center and the white matter goes to the outside, happens right here at the medulla, which means for a little piece out of your skull right here, the nerves are susceptible to any pressure a lot. They're exposed. By the time you get down to C4 and C5, the white matter is around the gray matter and it's protecting it. So yes, it's not good to have pressure there, but it won't be right on the nerves. It has to go through the insulation to get to the gray matter. At the medulla oblongata, the brainstem, there's two things happening. Also, the right side of the brain has to cross over to the left side. The left side crosses over to the right. And there's a lot of nerves on the right side that go straight down and stay on the right, but there's a lot of crossing over. And when you look at the anatomy, when you cut this off and look down, you see this thing called the crus cerebri, which means cross of the brain. And you see this crossing effect. So right at the brainstem, right here, this little piece, you have the crossing over, which exposes the gray matter, which is you. And then you also have the involution, gray matter going to the center, white matter coming to the outside. So by the time you get down to C3, C4, you've got that separated out, and you see this butterfly type structure in the center, and you see the white matter on the outside making a round spinal cord. And I'll put a picture of that there. And that's why it's so important to have that atlas allowing that spinal cord that's now exposed with gray matter being exposed for a little tiny segment. It needs to be in the center of the medulla. the center of the atlas hole, the center of the axis hole. And that's why this is so important. And you often wonder, right where God put the vertebrae having 90 degrees of motion, the atlas moves 45 degrees to the right and 45 degrees to the left. So there's 90 degrees of motion there, turning your head. Right where that happens is right where the nerves are the most susceptible. Right there. Why did you do that? Why didn't you put the atlas around when there was a white matter protecting the gray matter and it was safe? First, I don't think Adam and Eve, were made this way. Something happened when they left the garden. Some things got crossed over. And that's one of the things I think happened. Death can be easily explained by putting pressure on that medulla. And you've seen movies where they come up and chop somebody right there or put pressure at the base of the skull and the person's just dead. Because right there is a very susceptible area to nerve pressure. And that's why we spend so much time making sure it's balanced to the center and not pushing on the spinal cord. Migraines are one of the biggest problems we have when that atlas is not centered, not floating around that spinal cord. It's hitting the spinal cord, and the gray matter is exposed, and you get nerves going back up into the skull, and your brain actually hurts, and it's called a headache or a migraine. And you also get arm pain or radiating pain from that pressure on that brainstem. So that's what I want to talk about. Thank you very much. Like and subscribe.